Hi everyone, I'm Chandra. I'm a technology consultant at Accenture the Street Over, aligned to Health and Public Services. My thoughts are my own and they do not reflect those of my employer. I also have served as Miss Raleigh for the previous year and Miss Gardner for this year through the Miss America organization. And through that organization, we are encouraged to be vulnerable and advocate for a community service initiative. I have been working with Hope Connection International, and they referred me to this event today, and they work closely with survivors of domestic violence, intimate partner violence, IPV, and substance abuse, and those chronic woes are closely linked to one another. I personally had an experience with a mental health facility this year that I have not disclosed. I'm an NC State graduate and alum, and there have been a number of suicides this year. And in February, I thought I was having a heart attack or a stroke. Turns out that was my first ever panic attack as a result of these tragic losses. And I was taken care of by the Durham Emergency Medical Services, EMS. And then my healthcare provider subsequently referred me to a private mental health care facility where I was severely mistreated. And I had to wait till Monday to receive care from a physician as well as the nurses. I was admitted on a Friday, and I asked many times what the procedures were, how I could comply with them, and I was screamed at for just asking for a cup of water, amongst many other words that were thrown at me. And I, as a middle class person, I did not take that very personally, but those 4 days were excruciating. And I was taken better care of by the veterans that were there and the people that were recovering from schizo-affected disorder. My roommate was an elderly lady, and they had had her diaper in the bathroom unclean. I cleaned that because I have experience as a guest services volunteer at Wake Med here, private hospital. I took her out on her wheelchair because the staff there were not taking care of patients. It's a private facility, but then I thought that I could be liable, so I stopped doing that. I didn't know what was going on. And now I have to escalate up the chain if I even want to their patient advocate, but I barely have time now that I'm back to my adult schedule. And on the private sector side, as a middle class family, the copay was over $900 for those 4 nights. It echoes recidivism. I asked to not stay at the facility. I asked to return when the physician would be there. Clearly, there are echoes of recidivism and the prison industrial pipeline here, and it seems like Wakebrook, as a public mental health care facility, has been able to rectify these woes and actually provide quality care to individuals who are recovering, which means the world day in and day out, because even the words from staff can affect a person positively or negatively. Thank you so much.